Do you need help finding health-related services? Medicaid offers free case management services to families with children who have health conditions and to women with high-risk pregnancies.
Going to see so many different specialists and therapists is so overwhelming. With my child's diagnosis, it's just so much. Not just for me, but for everyone in my family. Some days, I don't know where to begin.
Case management helps with medical services, school issues, medical equipment and supplies, and other medically necessary services.
Case management is connecting a social worker or a nurse with a family to help the family get the services that they need. Often there are a number of medical needs in the family. We meet with the families and we find out what all of those needs are, whether it's dealing with finding a doctor, a therapist, or helping with school issues. And the other piece of it is kind of being a support for that family, getting to know the family, getting to work with them to learn how to navigate the system. Recently, I worked with a family who has a 6-year-old with cerebral palsy and other health conditions, and he is non-ambulatory. Well, he had outgrown his wheelchair, and the mother wasn't quite sure how to order a new one. So, with her consent, I contacted the child's physical therapist at the school, who also agreed he did need a new wheelchair. And the physical therapist and I worked together. We contacted the medical supply company that the mother had used before. They got the necessary paperwork from the child's doctor, and the physical therapist did a seating evaluation. Now this child has a new wheelchair. His mother was also not aware that Medicaid would cover his diapers, so I also requested that the medical supply company contact his doctor about a prescription, and now he gets his diapers through Medicaid. As case managers, we work to coordinate services and to be an advocate if needed. At the assessment, his mother brought up that his speech therapy hours at his school had recently been reduced. So I explained to her that she could ask for a school meeting, and I would be there with her as an advocate for her son. So we have a meeting this next week with the school. And these are just some of the things that I did with this family. But every family is different. So we look at what each family individually needs.
We have case managers across the state that are licensed as social workers or registered nurses. They work as individuals or employed by schools, health departments, counseling agencies, health clinics, and other types of agencies. These case managers work with families of children or pregnant women with special health needs or health risks. They help the family get the services that they have trouble finding on their own.
With each family, we're looking at the whole picture, not just at the pregnant woman sitting in front of us or the child with the health condition sitting in front of us. We're looking at all of the issues which may affect the child or the pregnant woman, including the home and family environment. So it's a whole array of issues that affect families who just don't know where to find services and don't know how to get the resources that are out there.
Who can get services?
Our program can help children and young adults aged 20 and younger who have a health condition or health risk who are covered by Medicaid. We also help women of any age with a high-risk pregnancy. In addition, the person or family must need help accessing services related to their health condition or health risk. Finally, they have to want case management. It's a free voluntary service.
If you're a teenage girl, being pregnant is a risk factor. If the girl is under 18, has needs related to her pregnancy, and has Medicaid, she could get the case management services we offer.
The people that we serve have various degrees of medical complexity. They may have behavior problems, they might have developmental delays, or they may have chronic and/or terminal illnesses. We work with children who have all kinds of diagnoses, such as autism, intellectual disabilities, cystic fibrosis, muscular dystrophy, or cerebral palsy. We work with pregnant women who have high-risk medical conditions, such as diabetes or hypertension, or psychosocial issues such as homelessness, alcohol or drug problems, or domestic violence.
Case managers work with the family to figure out what they need to deal with the health condition. Then they make plans, find local resources, and follow up to make sure the family gets the services or equipment they need.
So we do a comprehensive assessment to find out all of the needs a family might have related to the health condition. And then we come up with a service plan for the family that addresses each of those needs.
We can help families navigate through the system by linking them to needed services.
If a family wants the help of a case manager, it's very easy to contact one. Call 1-877-TH-STEPS and let them know that you need help finding resources for your child or for a pregnant woman. A case manager can help get special equipment that might be needed or find a pharmacy that carries a specific product that a child or pregnant woman needs. A case manager will also help families understand what Medicaid benefits the child or pregnant woman can get. There are many things that Medicaid might provide for children or pregnant women that they might not know about or might need help in accessing. That's what the case manager does.
How has case management helped?
My case manager was very supportive in getting other organizations to help me and getting the care that I needed for my baby.
I'm not sure where we'd be without our case manager. We've had some pretty difficult things happen, and without her, we'd be just lost, just drifting, hoping someone would help us.
Case management is available by calling toll-free 1-877-TH-STEPS. That's 1-877-847-8377.